Hi, this is Dr. Grażyna Pajunen, and today I would like to talk to you about a very common problem, and this is joint mobility discomfort. A lot of people actually, according to the recent statistics, every third person, adult person in United States has a problem with one or more joints, and they don't exactly know what to do about it. They are going to the doctor, and the doctors will have many or alternative medicine doctors, so the doctors have many different solutions for them, and many people are thinking, what is the best solution for me? So today I would like just to talk briefly about different possibilities. What are the options, so that maybe there will be somebody that this life could help. So one thing is, we have to understand how our joint is built and what is happening when we have this discomfort. And so the first thing is you have to understand that the joint is like you have one bone here, another bone here, it's covered with cartilage, and everything is in synovial fluid. And then the joint works very, very well. Well, what happens when we age? When we age, or when you use the joint a lot, then you dry out. That synovial fluid here is drying out, and then you have kind of bone-on-bone sensation, so that you destroy the cartilage right here. And then you have very often press on the nerve, and it's hurting. This happens in joints, but this also happens in your neck, in your back, between vertebra. When we dry out, then you have kind of bone on bone situation. So, this human articular cartilage is built basically from three components. Collagen number 2, which is about 10 to 20%, hyaluronic acid and chondroitin sulfate, and also keratin sulfate is from 1 to 20%, and other hydrocytes about 1 to 5%, and of course water, which is about 75%. And the reason why our joints start to hurt is that with age, we are losing collagen and hyaluronic acid about 1.5% per year from the moment that we stop growing. So around about 20 or 25 years old. So what it means is that we are drying out, because the synovial fluid, what I showed you here, that's actually built of hyaluronic acid. So when you lose it, we dry out, that's exactly what happened. So, and also what happens is there is no blood supply. With age, we are losing, let's put it this way, we are losing the blood supply to our joints. So what it means is all the nutrients, if we want to put nutrients in our joints, it's only through the synovial fluid. So when the synovial fluid is dry out, then there is no nutrients that can be helping our joints. So now you have a problem. Now you have discomfort. So you go to the doctor. So what the doctor can advise you to do? They can give you medication. But of course, you know that pharmaceutical drugs have terrible side effects. And also medication will not rebuild your joint, but they will give you relief because you will not feel the pain. But what's the problem with this? Big problem. when you do not feel the pain, but you have still bone to bone, and you just now will start move or exercise or get to chiropractor or whatever you start to do, you can even damage your joint even more. So it is similar, like you are driving a car and there is an indicator, no oil, red light, but you cover it up and keep driving. That's exactly what will happen to your body. So I think that it's great to have relief, but let's think what other solutions we might have to start rebuilding our joints. The next thing is the injections. So injection of corticosteroids, they can reduce inflammation in the lining of the joints and stop the pain. But it is also dangerous because, again, we do not feel the pain and we can overuse our joints. So we have to be careful then. Then the next thing, injections of hyaluronic acid. When hyaluronic acid injections are much better, but this hyaluronic acid, what they inject, the molecule are very large. So they really separate the bones and remove the discomfort for some time. But however, they will not rebuild your joints. The other possibility is platelet-rich plasma. Well, platelet-rich plasma, so what it is a small cell fragments that release chemicals that induce blood clots that prevent bleeding. And many clinicians have been started using injections of concentrated platelets called platelet-rich plasma, or PRP, to treat the inflamed or injured tendons, ligaments, muscles, and joints. And these methods are not always reported successful, and they are not proven yet, but they have some possibilities for the future. The next one, which is pretty famous, is the stem cell injections. And this is what it is. So it is possible to collect tissue from one part of the body and transplant it to another part. So bone marrow and fat can contain progenitor cells that can form new tissue, such as bone or cartilage. These cells are often called stem cells. And again, these are good possibility for the future, but at this moment they are not proven yet, and they are quite expensive and invasive. The next thing is the cartridge transplant. So the cartridge is grown in a laboratory and then placed in the damaged space. And this is very promising, but it only addresses a single joint and it's invasive. Finally, there is a partial replacement. So there is a partially, the part of the joint that has been destroyed is being replaced. It is, again, we are not rebuilding the entire joint, and the other part of the joint may be further damaged. So you have to be also aware of that. And next one, very popular, and this is very, a lot of people are actually thinking that this is such a simple thing to do, is the joint replacement, the entire joint replacement. It's very popular right now, and it's very common to treat joint problems. However, it's radical. It's an ultra-invasive form of treatment, and it is irreversible. So you really should think about it. And when it's done, there is no restoring your joint. Joint replacement are mechanical and are subject to loosening, stiffness, complications, and infections. And the problem may lead to follow-up surgeries down the road. It if something goes wrong, it goes very wrong. And it obviously should be used only in the last resort. Another thing is exercise, physical therapy, and lifestyle factors. So many people think, okay, it hurts, so I shouldn't move it. No, you should. You should move it. This is important. Walking, riding bicycles, swimming, all these are very beneficial for your recovery. Light training weight is very, very good. And lifestyle changing, especially losing weight, because if you put a lot of weight on your joints, that's very heavy for them. So this would be fantastic. Drinking a lot of water, cutting back on sugar, carbs, and making sure to give your body good nutrition and supplements. Finally, the last, which is amazing, new method, the very, very new, which has been proven scientifically that it works, is supplementation with collagen 2 hyaluronic acid and chondroitin sulfate matrix. There have been discovered a product that has that matrix of collagen and hyaluronic acid that has exactly the same proportions as what in our body is, and has also been optimized for the maximum absorptions. So this one would be very, very important for you to consider, because that one is it's just supplement, and it can restore your potentially your joints. So the all other methods, just I want to pay so that you pay attention, because all other methods which are described before had a problem that they are dealing just with one joint. Would it be medication? Would it be the joint replacement or less invasive methods? But they are solving the one joint. They do not go to the core of the problem, which is, give me the missing blocks, which I am losing, I'm drying out. I need collagen, hyaluronic acid, I need to be able to rebuild itself. Because if you give body what the body needs, the body can recover. So even if you replace one joint, look, you didn't solve the problem, because very soon the other joint start hurting. Maybe soon your gums will start having problems with your gums, with your eyes, with your internal organs, because we are drying out. So we would like to substitute or supplement in our body those components that are needed, that our body is losing, so that the body can start rebuilding itself. And since there are so many collagen products on the market, and many people are very confused, so let me just, that one requires actually another live, but very quickly. The one which is non-hydrolyzed, do not even consider. Too big molecule, it's not going to go through. The one that is hydrolyzed, but it's like only from cow and pig, like bovine and so on, it will not rebuild your joints, because it doesn't have collagen 2 hyaluronic acid chondroitin sulfate. You need that matrix. You need that matrix in the right proportion with the right molecule size. And number 3, the fish. Again, the collagen type 1 can help a little with the skin. The components with wrong proportions and with the wrong, the molecule size is actually okay. It is absorbable, but it doesn't have the right components. So be careful when you are considering supplementation. Ask, there's a collagen 2 hyaluronic acid chondroitin sulfate. Is it liquid so that it's absorbable at least 90%? And does it have the right proportion? And is it hydrolyzed? So this is all for today. I wish everybody, if anybody has any questions, just let me know, because I'm passionate about this. And I tell you, when I see a person who couldn't walk because their knee were hurting and they couldn't walk, and in 4 months, they called me, my God, I was just walking 6 kilometers. And another person who was crying and say, oh my gosh, I cannot keep the glass anymore in my hand. What will happen to me in the future? How my life is going to be? I don't even want to live anymore. And then in 3 to 4 months, she's calling. She said, come over for dinner. I can serve you dinner because I get so much help. This is what makes me happy. What makes you happy? Let me know. Thank you.